And thank you for joining me for the last lesson on the muscular system for this course. Today we're going to talk about core muscles and how aging impacts your muscles. And so at the end of this video, my goals for you are to be able to identify major muscles associated with the core. So identify specific core muscles. Explain the importance of core muscles due to their function. So what do they do? How do they work? And then tell me what happens to your muscles as you get older. So what has happened, what's going to happen, how does aging impact your muscles? So for starters, you have core muscles, and their main function is to stabilize the spine, which is the base of all movement. If you don't have core muscles, so a lack of core musculature is the main cause of those nagging injuries that people talk about, chronic back pain and things like that. A lot of that's to do with core musculature. And then as you get, have you ever done something that you usually always do, and then somehow you get injured doing it? So for example, you always take out the trash or something to that effect, and one time you take it out and all of a sudden you get hurt. Normally, that is caused by a brief failure in your core musculature to contract and stabilize your spine and keep you safe. We're talking about core muscles. We have a couple of different ones. These are called paraspinal muscles. These they run right along your spine and function to keep you kind of in line. So there's a couple different ones. So the splenius rotates your head, runs all the way up your spine, rotates your head. Your erector spinae extends the spine, so allows you to kind of bend backwards. So people that can do a back bridge, your erector spinae is quite strong and your other muscles are flexible. You have a transversospinalis, which is your transverse spinal muscles responsible for rotating the spine. This allows you to turn, so spinal twist, and rotate back and forth. And then you have your suboccipital muscles, which stabilize and extend the neck. So those are your paraspinals collectively. You have a set of thoracic muscles that also have their own function. A very important one is the diaphragm. When your diaphragm contracts, you increase your intrathoracic pressure, which is needed to stabilize your spine for when you lift weights. So when you take a breath and you hold it, it increases this intrathoracic pressure, which keeps your spine safe when you do, say, squats. And you want to breathe out, obviously, and not hurt yourself, but increasing that pressure is really important so that you can stand with the weight on your back. You also have these muscles called intercostals. These help us with respiration, which is breathing. So your external intercostals are your outer layer. Your internal intercostals are your middle layer. They're inside the rib cage. So externals are outside the ribs. Internals are inside the ribs. And your innermost intercostals are obviously right along your organs of the digestive tract on the inside of your body. So here's a look at them. So this is your external intercostals are on the outside of your ribs. Your internal intercostals are on the inside, and then beneath that you would have your innermost, which I think are shown over here. So those are your intercostal muscles. You also have abdominal muscles. So people talk about their abs. These are the muscles they're talking about. And all of these connect to the linea alba, which is the white line in the middle of your abs. We'll look at that in a second. But a couple of different muscles you have. You have your transverse abdominis, which is the innermost layer. And they have transverse fibers. So if you think of your transverse plane runs left and right, so these run laterally. Your rectus abdominis is what we think of as having abs. These are on the outside. These cause flexion of the torso. So for you to do sit-ups, you're working your rectus abdominis. Your obliques function as flexors and rotators of the torso. So you have two sets. You have internal obliques and you have external obliques. So internal runs from the superior medial to the inferior lateral. So if I'm going to have a person, I'm going to show you on the next slide. If I have a person here, laugh at my drawing later. But my internal obliques run from the superior medial to the inferior lateral. So they run this way. And I'll show you this on the next slide in an actual picture so you see it. Your external obliques run from the superior lateral to the inferior medial. So they run this way. So they crisscross. And they look like this, if they're actually drawn correctly. And so here you have, this is your linea alba, that white line in the middle of your abs, runs right down the middle of your body. Your rectus abdominis is here. Notice the fibers run this way. So if you contract, you pull your torso to your hips or torso to your knees. You have your transverse abdominis beneath here. This pulls sideways. So this allows you to flex and turn. Your twist and turn. Your internal obliques, again, run superior medial to inferior lateral. And your external obliques run superior lateral to inferior medial. So these are your muscles all overlapping and overlaying one another, and this is how you are allowed to move. When it comes to muscles, you also have this pelvic floor. And so when your core muscles contract to the pelvic floor, and the reason is this pelvic floor helps stabilize things. So when other core muscles contract, your pelvic floor will also contract and stabilize the internal organs. So this is how you have all this pressure on top is stabilized by the pressure on bottom. We won't talk much about these, but you can look at them on your own. They won't be on any sort of assessment I give you. If you hear about Kegel exercises, they're done to strengthen your pelvic floor and improve problems with incontinence and sexual function. If you have issues with incontinence, they will give you these Kegel exercises to help you out with that, help regain control. And the last little bit we're going to talk about is aging in muscles. So as you get older, your muscles get stronger to a certain point. So when you hit puberty, up until you get to 25 to 35 years old, your muscles are going to develop and strengthen and grow. And somewhere between 25 and 35, you hit your peak. After that, your muscles require a lot more maintenance in order to stay where you want them to. In your 40s, your muscles start to break down and get a little bit weaker. And then as you get older, eventually you're going to get to, hopefully, up into your 80s. When you get to be 80, you have about half the muscle mass you did when you were 25 or 30. And so that just happens. Your body doesn't use them as much. So unless you are a workout nut that's always exercising and staying healthy, the real important thing here is you don't get injured, because injuries really set you back, especially as you get older. But your flexibility and durability of muscles is greatly diminished as you age. So you become less flexible. They have less resistance to fatigue and injury. So it's really important that you're careful. But as you get older, that really diminishes. And that is how aging impacts your muscles. Here are some review questions for you. Again, this is our last section of the unit. And so we will begin reviewing everything all together, and then we'll have a chance for you to show off all the things you've learned about the muscular system here shortly. But what do core muscles do for us? How do muscles in our thoracic cavity help us breathe? And what happens to your muscles as you age? Be sure you can answer those questions. If you have questions for me or would like help with some of this information, please come see me. Otherwise, I will see you soon.